this Tuesday is such an important vote for everyone, and we're just super excited. This seat has always been held and maintained by a Democrat because we always believe in this district on democratic principles, such as the right for all of us to vote and to make sure that everyone's included with the basis of equality. And so this is what this election really is about: preserving our democracy, preserving our democratic tenets. But most importantly, when we were sitting in this pandemic, even now, it's always been our Democratic Party who has been fighting for us to have access to healthcare, us to have access to better jobs. And as a Democratic candidate, and also as a healthcare professional in the community, as a CEO, I've always been fighting for our community to have economic justice as well as healthcare justice. And we see right now, more than anything, we need a strong Democrat in Congress that can really help us facilitate those needs for our district. My platform has been on economic justice. And the reason why I say economic justice is because we realize that economic growth has a real social justice component to it, where we don't see the same amount of women-led companies, small companies, minority-owned companies who are having access to federal funding and grant opportunities, and even contractors. So that's always been important in our district, so we can actually see more job development, so we can see our district actually growing and ensure that our district, our constituents actually have access to healthcare. So that's been my platform from day one: economic justice and social justice. There could be no economic justice, no social justice without economic justice. And also healthcare. Healthcare has been so imperative in these last few years, making sure that everyone has access to healthcare and that everyone's able to pay and afford their prescription drugs, and that there's mental health readily available for everyone in the community who would like to have access to it. And those are the tenets that I've been fighting for from the beginning. It's been about more than 9 months now that we've been fighting, and we know that these are the services that the community desperately needs. So the People's Prosperity Plan is definitely one of our economic initiatives. It actually became one of the most popular, even though we had so many different ones. And in our economic prosperity plan, we're proposing that we can give, for us to give continued stimulus checks for any family making less than $75,000 per year. Now, this economic stimulus plan is very similar to a present bill in Congress. By the time we actually put forth our plan, probably 8 months ago, maybe 6 months ago now, we saw that Representative Congresswoman Ileana Omar put forth a similar proposal for 1,200 checks. The reason why we leaned on our People's Prosperity Plan, which was only $1,000, because we've been seeing pilot programs throughout the entire country. But these programs have been spearheaded by municipalities and localities, which means that it's not an equitable way for everyone to recover. If you're not living in those districts, if you're not living in that city, then that means you won't be able to recover. And when we think about our district, which has such a large population of seniors, it just isn't right, and it is not fair that our seniors should not be afforded to recover, the right to recover, like most people around the country that we're seeing right now. So we honestly take the position that this needs to be a national initiative where everyone has the right to recover in the same manner. And we saw before that direct payments were actually helping the community. And we also see the child tax credit has been alleviating childhood poverty by 60%. So what would that be for our district? How could that impact our district positively? We believe that right now, with such a hard time with COVID, with so many people who can't go to work, so many singles who can't go to work because they're sick and they're not getting paid, that this would actually allow people to recover at home peacefully and also maintain their economics, and actually give them a chance to actually sustain economic well-being instead of being forced into poverty. Well, the qualifiers are household. It's a household we were looking at. Any household, anybody who's in the household, if you're making less than 75,000. Embedded in that also, we also want to have some incentivized programs also so that they can help get more jobs, especially with the infrastructure bill that we saw pass. So if we're able to piggyback and combine all the initiatives that are going forward, we truly believe that the People's Prosperity Plan will help a lot of people stay in their homes who are having problems with housing, or even pay simple things that I get calls about, like people not being able to afford to pay their taxes for their houses. So the people need an immediate solution, and a direct payment while we're still in this burden would definitely alleviate their pain. Well, our district is 60% minority as far as Black, and our district is 40% non-Black. Within there, we have a good number of Hispanic, and we also have a good number of other Pacific Asian countries also. Well, my background, I'm a mom, I'm a wife, and I have two teenagers who are 17 and 18. And I originally got into politics, not from a place where I wanted to ever be in politics. I was more comfortable with advocacy. So I advocated for children with learning disabilities. I advocated for healthcare, being a healthcare executive and seeing the impact of the community without healthcare. My business in healthcare, we specialize in Medicare and Medicare patients, which are people in our community. So we saw the devastating effects, and that's how I got into advocacy and figuring out how we can meet the needs of the community while still delivering what we promised, which is healthcare, healthcare to the community. And then in addition to that, my ethnic background, my parents migrated here from Haiti and Dominican Republic probably in the 1960s. So I was the first generation American in my family. I went to Howard University for my undergraduate, University of Maryland for my MBA, and St. Thomas University for law school. And upon graduation, I fell into healthcare regulation. And that's what got me here.